Hello, and welcome to the PCARD Introductory Series. In the next few minutes, we will provide a short overview of the PCARD Cardiac PET modeling tool. PET is routinely applied for the study of perfusion, metabolism, and the viability pattern of the myocardium. However, when using relative images, some types of disease cannot be diagnosed without ambiguity, and absolute quantification is required. An example of this is globally reduced perfusion due to multivessel obstruction or microvascular disease. In these cases, PET images must be acquired dynamically and analyzed with sophisticated techniques. Our cardiac PET modeling tool facilitates the quantification of dynamic cardiac PET images. The user is guided through a sequence of processing stages in a streamlined workflow. Quantification is performed on the basis of our proven kinetic modeling technology. The results are summarized in comprehensive reports and can be saved for further analysis. A variety of tools are available for the investigation of the outcome, supporting all needs arising in cardiac research environments. The following 3-minute demo will give you a brief impression of our cardiac PET modeling tool. It uses ammonia PET rest and stress data from a patient with reduced coronary flow reserve. The temporal uptake in the 17 standard segments of the myocardium will be calculated, and a kinetic model fitted for estimation of regional perfusion. Finally, the result is inspected and documented. Both rest and stress images are loaded into the cardiac PET tool. The stress images appear in the upper row, and the rest images in the lower row. Rest and stress data analysis is performed in parallel. Next, the images are brought into the standard short axis orientation, which is the basis for the standard 17-segment definition. The program then detects the outline of the myocardium and uses this model of the left ventricle for calculation of the segmental PET uptake during each acquisition. The resulting time activity curves are shown together with the blood activity in both ventricular cavities. In the next step, an appropriate kinetic model is applied to the uptake curves, resulting in a perfusion estimate per segment. The results are arranged in polar plots and tables. The coronary flow reserve can easily be calculated as the ratio of flow at stress and rest. Healthy reserve values are above 2.5, abnormal values below 2. A convenient summary of all results is provided on the report page. It lists the absolute perfusions and the coronary flow reserve in all segments and flow territories. Additionally, the outcome is visualized as polar plots and a segmental bar plot of the reserve. For this particular patient, the coronary flow reserve is generally reduced to about 1.7, clearly below the normal range. The various procedures involved in cardiac quantification are complex and may sometimes need manual intervention. Our tool therefore offers many ways to investigate data processing. The data sampling for creation of the segmental uptake curves is a crucial point. Investigation of this data sampling is supported by an interactive 3D rendering, which shows each sampling point as a red dot, together with orthogonal slice images. As can easily be seen, the sampling points correspond to the locations of maximal wall uptake. This ends our short introduction to the PCARD Cardiac PET modeling tool. Trial installations are available to test the full functionality of PCARD and its tools. Please visit our website for further details and for information about the other products from PCARD Technologies. Thank you for your attention.